Infectious disease Dr. Zain Chagla joins us this morning now with the latest on the pandemic and vaccinations. Good morning to you.
Good morning, Annette.
So we're walking that fine line still where we're in Canada encouraging more people to become vaccinated, and yet we're hearing about countries that have almost no people vaccinated yet.
Yeah, I mean, I think obviously as we're dealing with new variants emerging, this is the root cause of all of it, right? We have a tool in our hand. This is very different than 18 months ago, where we can actually prevent people from getting infected, or at the worst case, limit how sick they get. Canada has stepped up. I mean, we've been trying to get AstraZeneca essentially, pushed out to the rest of the world, and 17 million doses are going. The U.S. is putting Moderna in Haiti and other countries. I think this effort is good. And as we kind of get to the peak of our vaccines and have enough vaccines on our soil to immunize everyone who wants one, the efforts to go globally are even more important now. And again, focusing on the world rather than necessarily focusing internally on boosters, which seems to be the thought of the day.
You mentioned Haiti. There was a report this week that said the Caribbean and Latin America, some countries are lucky to have 14% of their population vaccinated. Others have less than 1%.
And those numbers are probably still inequitable within those countries, right? It's probably the savvier people, the more financially stable people, the ones that can access healthcare, hopefully healthcare workers and those who are elderly. Again, we have, 7 to 8 countries taking over 75% of the world's supply of vaccines and pushing them out into their population. We're vaccinating 29 million people a day around the world, and only 1% of that is going into low-income countries. And again, that disparity is growing and growing and growing. It really is a shame knowing that we're opening up and thinking about life going back to normal, and other places are dealing with just death and disability from this infection, both in their adults and children.
Right, because as we've talked before, this isn't over until it's over for everyone in the world, right? Because as things start to open up, more travel, it's so easy now to take a virus from one end of the world to another within hours.
Absolutely. And I think we're seeing this, in places in the world with poor vaccine rates, even, places that have had Western finances. So Australia, are back in lockdown again because of the spread of the Delta virus in Sydney and Melbourne. And lockdowns aren't benign for places in the world that are at low income, right? They have significant effects in the worsening poverty, malnutrition, childhood diseases. There's data now that childhood vaccine campaigns have been disrupted by COVID-19. These aren't benign lockdowns in some places in the world. And again, it's our duty to make sure that they're minimized as much as possible.
Right, because even though we're in step 3 and we're celebrating because, some of that veil has been lifted, but it's not really, we shouldn't really be celebrating that much because the pandemic is not over.
Yeah, I mean, I think we've done a good job. We have a tool, and Canadians have stepped up, rolled up their sleeves, and thankfully for it. But again, this isn't over until equitable access is there around the world. And again, it's taken years to get immunizations to spread around the world for measles, for smallpox. It's going to take years for this to redistribute. Hopefully, again, with Canadian and other places having local production, we can start pushing vaccines into the places that they're needed instead of revaccinating individuals that don't necessarily need it right now.
Right. Okay, lots of things to think about as we enjoy that little step 3 that we're taking. But again, to keep in mind that we're still not out of the woods yet. So, Dr. Zain Chagla, thanks very much. You have a great weekend. Be safe.
You too. Be safe. Take care.